Good afternoon, Long Beach, and we of course are going to do our COVID update like we always do. I want to just start by saying a few words about what's going on right now in Washington, D.C. I think it's no question that what we're witnessing today on our televisions and on our computer screens is sickening. It's horrific, and it is not who we claim to be as a country. I think most of us have been angered and saddened. I have been by the actions of really what is an attack on the Capitol building in D.C. And it's also it's really disappointing that leaders in this country, including the president, cannot use strong words to denounce what is happening in our nation's capital. And I think that for us to not be able to condemn those actions in the strongest terms is really a sad day. This is a day that we should be closing out our democratic process for an election. And so I want to just send, I think on behalf of everyone in our city, the most love and support to all of the staff that are there, all of the members of Congress and others, including our very own members of Congress, Congressman Lowenthal, especially Congresswoman Nanette Barragan, who represents part of North Long Beach. Our thoughts and love are with them, their staffs, and everyone at the U.S. Capitol. I also just want to add that this is a serious day, and the Long Beach Police Department and our city team, of course, have been in conversations throughout the day and are monitoring city assets, our regional assets, are working with our federal partners, and are ensuring that Long Beach remains safe. We have kind of increased our monitoring presence, and we are closely watching not just what's happening here, but also what's happening in D.C. and across the country. So that will continue, and we will get past this. Hopefully, the sooner the better. But while this is all happening, we still have a massive crisis as it relates to COVID. But we also have an opportunity, and that is to vaccinate as many people as possible. And so we're having this today because I want to make sure that we get you as much information as we can around vaccinations, first and foremost, what we're doing, how it's going, and where and what's next. And so I want to talk a little bit about vaccinations. And then we also have our director of our health department, Kelly Colopy, who's here, who'll be able to also talk about what's going on with COVID, but also answer some great questions. So we'll do that at the end. So let me start with our vaccine rollout. First, as most folks know, while the state certainly is guiding the city as part of a region as it relates to the reopenings and the economy, our health department is doing its own vaccination process, just like we're managing our own testing process. So we in Long Beach manage our testing operation, which I think for the most part is stellar, and one of the best, by the way, I think in the state and the country. And we're managing our vaccination process, which I also think is actually going very well and much better than some of the horror stories I think you're hearing about in other places. So, of course, we've discussed this now for a few weeks. We are right now at the tail end of Group A. Group A, of course, are our hospitals, our clinics, our healthcare facilities, nursing homes, including the staff and those that work there, our paramedics, those that are EMTs, which many of them are firefighters. That whole group is Group A, with essentially our medical teams, our doctors, our nurses. That group, our goal has always been to finish. We've talked about this as hopefully around January 10th, January 11th, as we start our Group B, which we'll talk about in just a minute. So far here in Long Beach, we know that we about 75% of all of our workers in our hospital system have been vaccinated. That we still have about 25% approximately that have not received their vaccination. And you are hearing some stories of some folks that may not want to receive it. That's the case everywhere, including here, and others that have not yet received their vaccine or have not yet been able to get their vaccine are in that 25%. The bright spot is that number is actually much lower than what you're seeing in other parts of the state or the country. We're seeing some counties where it's 50% of their hospital workers. And so we're going to work to get that 25% still vaccinated, but we are at 75% of our hospital healthcare workers. And we're getting through all of our clinics and nursing homes and all of the rest as well. So we are thankful for that. We also want to let folks know that we are concluding and vaccinating all of our paramedics and our paramedic units, our firefighters. We have partnered with our pharmacies like CVS and Rite Aid that are going into our nursing homes and vaccinating. I'm hearing stories back from doctors and workers at our nursing homes who are just so grateful to have been vaccinated, and I'm really grateful to hear that as well. Now, we've been hearing a lot, and we've always expected this. There have been some clinics that are saying we haven't heard anything yet, or some small medical offices that may say we don't have access to the vaccine, or we have not yet gotten our doses. That's okay. We are still in Group A, and I'm going to tell you today how we're going to close that gap. And it's important to note that this is not a perfect process. We're trying to get through everyone as best that we can as the vaccines come in, and they come in weekly. So we vaccinate as vaccine shipments come in. We are not sitting around and waiting. We're vaccinating every single day, folks in our city. So if you are a clinic or you have a small office, medical office, you're part of this group and you have not been vaccinated, or for whatever reason your employer or your place of business doesn't have access to vaccines, there are two ways to get vaccinated. So we want to get all of you vaccinated immediately because you are in Group A. The first is you can email COVID-19 vaccine at longbeach.gov, or you can call 570-INFO, and you can press number 6 or just hear the prompts. So call 570-INFO or COVID-vaccine at longbeach.gov. That is the best way if you are a clinic or you have a medical office to get your batch of vaccines, or so that we can schedule a vaccination clinic for you. That is the first way that you can get your vaccines. The second way is we will be beginning next week to host vaccination clinics for Group A. So if you work in a clinic, you are a medical worker, you are providing medical services, and you have not been vaccinated and you're starting to get worried, no problem. We're going to take care of you, and those clinics begin next week. How do you sign up for a clinic? You email the email I just mentioned, COVID-19 vaccine at longbeach.gov, or you call 570-INFO. When you go to one of these clinics, you will need to show proof of your medical place of business, that you are a worker at one of the clinic or a healthcare worker. And almost all health workers across the city have some type of identification. So vaccine clinics begin on Monday of next week, and we're going to continue to roll out the vaccines for Group A. So if you're in Group A, I know a lot of folks have been stressed. You can get a vaccine. It's going to be available to you. Sign up. We're going to get you an appointment and get you vaccinated. So that is information we hope also our friends in the media will get out so that we can finish up Group A. And just because we're about to start Group B doesn't mean Group A is done. So if for some reason you couldn't get your vaccine and now we're starting our essential workers, a group never closes. So once we open up Group A, that group doesn't close when Group B starts. You can still get your vaccine as we go into Group B or Group C. So that continues. Now let's talk about the next phase. And as we go into this next phase, one of the questions that we're getting for Group A and Group B is, what if I am a Long Beach resident, but I work at a clinic in Orange County? So the answer to that is we want to vaccinate all Long Beach residents if we can assist you. We would ask that you first reach out to your medical place of work and see when they're going to vaccinate you, because really it's the place of work that's supposed to do the vaccination. But we also understand that we're not going to leave any person in our city behind and unvaccinated. So my message to you is, if you are a Long Beach worker, a resident of our city, if you're a Long Beach worker, you work here, you're going to get vaccinated through a clinic. But if you live here and you work in Orange County or in LA, or somewhere in LA County, or you work somewhere distant, and your place of work, for whatever reason,